My name is Danielle Vaughn, and I will be presenting a case over a filar cyst. In this presentation, you'll be informed of the patient's history, the scanning technique, 2 differential diagnoses, and we will also be going over ultrasound images. Let's begin by defining a filar cyst. On ultrasound, a filar cyst will appear anechoic because it's a cystic structure which is completely contained within the filum terminale. And many of you may be unfamiliar with the term filum terminale. It is the fibrous tissue that proceeds down the conus medullaris, or the tapering portion of the spinal cord. In this case study, my patient was 6 weeks old and he presented with a sacral dimple. And you can get a sacral dimple, if you can recall from last semester in OB when we discussed the zipper and how it zips shut at both ends. Well, a sacral dimple will result if there's just a notch or glitch in that zipper. And a sacral dimple will be present at birth. You should be cautious if the dimple does have hair, skin tags, or discoloration associated with it, because this means there's an increased risk of spina bifida or tethered cord syndrome. Filar cyst does not usually have any abnormal lab values associated with it. However, spina bifida, if they were at risk for that, there would be an increased AFP in prenatal testing. And here we have a picture of a sacral dimple, and this is very similar to what appeared on the lower back of my patient. For this particular scan, you will want to use a 9 megahertz linear transducer, and your patient will be prone or laying on their tummies. And be sure to always scan in transverse and sagittal imaging planes. Here we have an ultrasound image. It's actually on dual mode. On the left, you'll see a sagittal image, and here is the filar cyst shown in the spinal cord. And on the right-hand side, you'll see a transverse image, and here is the filar cyst within the spinal cord. Now, this image is the same as the previous, except this image contains the measurements. This particular filar cyst measured 8 millimeters long by 2 millimeters in diameter, so it's relatively small. Now, the diagnosis given by the radiologist stated a small incidental filar cyst measured up to 8 millimeters in length and 2 millimeters in diameter, like I stated previously. There was no filar thickening, and the filum did appear more tight than expected, which just means the nerve fibers within the filum were not vibrating as loosely as normal. In summary, again, a filar cyst was found in both sagittal and transverse scan planes of the lumbar spine, specifically located at the 3rd lumbar vertebrae. This is known to be a benign and sometimes even normal variant of the spine, so no treatment or follow-up was recommended. The first differential diagnosis I will discuss is the ventriculus terminalis. This is also called the 5th ventricle. And unlike the filar cyst, it is located inside the conus medullaris, or the tapering of the spinal cord, rather than below the conus medullaris, like the filar cyst. There is also communication between the cyst and the central canal of the spinal cord, whereas a filar cyst, there will be no connection with the spinal cord. Similarities between a filar cyst and a ventriculus terminalis include that they're both cystic structures found in the spine, and both will appear anechoic on ultrasound. Another differential diagnosis is syringeomyelia, which is a fluid-filled cyst within the spinal canal, similar to the filar cyst. And they will both appear anechoic on ultrasound. However, syringeomyelia is caused by protrusion of brain tissue into the spinal cord, and this will actually block cerebral spinal fluid circulation, so it is much more concerning than a filar cyst. Thank you for watching my presentation over the filar cyst. I hope you enjoyed it, and please contact me if you have any questions.